Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Types of the radiolucent stones. So this includes TIXU, that is a triamterene. Then it includes the indinavir. Then it includes the xanthine as well and the uric acid. So what is the triamterene? Triamterene is the excessive. So there is the excessive use of the potassium sparing diuretic. So this leads to the formation of the radiolucent stone. Then we move on to the indinavir. So indinavir is a protease inhibitors used in HIV, protease inhibitor. So this inhibitor, it is used in case of the HIV and it leads to the formation of the radiolucent stones. Next is the presence of xanthine. The xanthine is observed in the xanthinuria and conversion of the hypoxanthine to the xanthine. So this is red brick in color. It is brick red. It is red in color. Then comes the uric acid. Uric acid is the most common type. It is a radiolucent renal stone. It's a radiolucent renal stone. To learn and grow daily like this, please do subscribe.